Hi, my name is Melissa. I am a nursing student from Cedar Crest College. My presentation today will be on the search and retrieval process for the clinical question, also known as the PICO question, among patients in the ICU. Does the implementation of early ambulation and early mobilization compared to bed rest decrease length of stay and increase functional status? So, to go straight into why I chose this topic, I've had the opportunity to go into the intensive care unit and work with an interdisciplinary team to encourage patients to ambulate. And it was through those experiences that I really wanted to learn more about why we're doing this and what is the benefits for the patient. So the significance that this particular PICO has to the nursing profession is that 20% of muscle loss occurs in just 1 week of bed rest. When you couple that statistic with patients, approximately 60% of patients staying at that muscle loss and that muscle dysfunction up to a year after being discharged, that's a very significant number, and it immensely impacts patients' quality of life and overall their daily affairs. And both of those statistics are from DANG 2013. So as nurses, we really need to advocate for best practices that are available to patients and do our best to try to combat any adverse outcomes that could be very prevented in the ICU and critical care setting. So my process of literature search began with 3 databases: Medline, CINAHL, and Ovid. I used key terms and phrases including intensive care unit, critical care, functional status, early mobilization and early ambulation, bed rest, and length of stay. So all of these key terms used on these databases revealed 50 searches for Medline, 40 for CINAHL, and 129 for Ovid. And I was able to use limitations that were within 8 years of current research, articles from the United States, and full text articles. So out of all of these that I found, I narrowed it down to 3 that were used for my evidence synthesis. So the 3 that were chosen were Cambuya, Tipping, and Lee, all of which had the purpose to investigate the current literature surrounding early ambulation and overall exercise in the intensive care unit for critically ill patients, and how this affects them and their outcomes. So all had very similar results and outcomes, being that patients were able to have decreased adverse effects from bed rest because they were ambulating and up using exercise. Patients that were on a ventilator, when implemented early enough in therapy, were able to have less days on the ventilator. That's referred to ventilator-free days. Patients also had increase in muscle strength, particularly respiratory muscles and peripheral muscles. And all of these studies had recommendations that were that would be able to be implemented in practice. So the first recommendation was to start a protocol for these organizations, one that provides safety for the patients as well as the staff members, and also really dialing in on those ideal doses of exercises for multiple patients with multiple different critical care reasons for admission. So another recommendation, and that was from Tipping. Another recommendation from Tipping as well was to educate all staff members that would be included in the care of patients in the critical setting, and really teaching staff members and everyone that's involved in a multidisciplinary manner why we're doing this and why it's helping patients. So another one from Lee was to initiate the implementation of exercise in patients that are mechanically ventilated. It was shown that when implemented within 24 hours of admission, it really decreased the amount of days that patients were on the ventilator by really increasing those respiratory muscles and allowing less sedation for these patients. So those are all positive things for the patients. Also, another recommendation was to really continue the conduction of high-quality research to really find the precise number and ideal doses of exercises for these critically ill patients. So, in conclusion, all of these studies agreed with each other in saying that exercise was favorable for patients in the critical care setting, and that it decreased slightly the time in the hospital and ICU, as well as increased functional status. So that is my presentation. Thank you.